obviously a lot of people in Kiwanee County are very active. I run, you go along the trails or on the roads here in Kiwanee County. People are fat biking. If we had enough snow, I think cross country skiing would be a lot more popular. And there's a lot of winter activities, hockey, another one, where, it's good to get out there and get exercise, but I mean, it definitely beats on your joints, especially during the winter. And you might have a solution for people who are very active and kind of use their joints, knees, legs, go along there. So how can you help those athletes or maybe just active people in general so they can maybe feel a little bit better?
Well, in chiropractic, most of us are very well trained in dealing with what we call extremities, be it your knees or your ankles or your elbows or your shoulders or whatever. If you're somebody that trains a lot, running in particular, which I think over time it kind of beats on your body, and most runners will tell you that. They feel it over time. What we do in chiropractic is, say if you come in with a sore left knee, and every time you run, it's sore when you start, it kind of tones down when you're running, but when you get done, you have to sit down with an ice pack. That would tell me that your knee is misaligned somehow. It's working, but it's not working great. So what we do is we adjust your knee a few times, get you in some ice. Usually, though, the first thing we do is clear out the spine. So we go to your lumbar spine, and as those are the nerves that innervate your leg. Clear out that nerve pressure so that knee has every opportunity to heal up with what we're trying to do. Say if I adjust your knee 2 or 3 times and we get absolutely no result, then we take what we call weight-bearing x-rays of your knees. We'll stand you in front of the x-ray machine, take a shot, so we can see the rotation and see how we need to adjust that knee. Granted, if nothing I do helps you, or if you refuse to stop running and you continue to have trouble, then orthopedic eval might be necessary just because you need to pay attention to it. But as far as general, I think people who are into sports don't understand that getting adjusted on a regular basis, not only their spine but their extremities, keeps them at optimal performance. And when you think about these people that do the triathlons and the marathons and long distance running like you do, I mean, it just makes sense to do whatever you can do to keep your body working as best it can if you want to continue to do that as part of your lifestyle.
What do some of these adjustments kind of entail? I mean, we've gone over in recent weeks, what you do in terms of going through the back and kind of adjusting there. How do you adjust the knee? How do you adjust an ankle or some of the other extremities that are really prevalent in some of these outdoor sports like running, fat biking, cross country skiing?
Well, there again, say if you're having trouble with your knee, we lay you on one of our chiropractic tables face up usually, because your femur is usually more of the problem than your tibia or your fibula. But we adjust using our hands. It's never a very forceful adjustment. A lot of times extremities will move pretty easy, so it's just a matter of giving them direction and giving them, just sliding them in, so to speak. And as far as an ankle goes, I mean, there's a lot of bones in your foot, and like if you twist your ankle and you get that external rotation or that talus bone shifts to the outside, we need to adjust that back in place as quickly as possible, just because if you don't, your body forms this soft tissue scar issue going on. And the longer you wait, the more it builds. So it's just wise to get that stuff taken care of right away. But generally, it's not a very forceful thing, and it's something that we do with a lot of people every time they come. We work on certain people's shoulders and knees and ankles and whatever.
I was just about to get into that. We've covered a lot of the lower body, but cross-country skiers, obviously, they're really pumping those arms, and even runners a little bit too, I guess, but definitely more the cross-country skiers just because they're making those forceful jabs and really pushing off against that. How do you adjust shoulders, and how important is that to get adjusted if you are in that situation where you're really working those arms in a relatively violent way, especially if your form isn't great?
Right. Well, if you're having pain on a pretty regular basis, there again, that shoulder's not working very well. We adjust shoulders sitting a lot. We've got a technique where we get behind you and in essence grab your elbow and pull the shoulder up into the joint. We also work on shoulders with you laying face down and do some rotation and traction. The thing about shoulders is first thing people think about is, I must have a rotator cuff tear. Well, that's just kind of a thing that gets thrown out there when somebody's shoulder hurts. And I've seen many people that have come into my office over the years say, yeah, they said I have a rotator cuff tear. and I evaluate their shoulder and check out their neck and make sure they're not having a neuritis. Because many times you can have a neuritis in your neck, even though your neck doesn't hurt, that makes this hurt because it radiates the pain. And a lot of patients will come in, and every time I do this, it hurts and whatever. And there's a bicipital tendon here that gets inflamed, but we adjust the shoulder, get them using some ice. Sometimes ice makes the shoulder ache, so I said if that's the case, maybe try a hot washcloth or something like that. But generally, clear the spine, adjust the shoulder, find out exactly how it needs to be adjusted, and work on it accordingly.
Now, I kind of alluded to it earlier because I know this is when I will eventually have more problems than I can handle. I'm sure other athletes out there have it as well. Form, really important. How important is it to you, at least as a chiropractor, just good, sound mechanics and form as they perform some of these things?
Well, when you think about your structure, well, it's interesting you say that. Like when I'm sitting at a stoplight, I watch people walk across the street, and I say, oh, they got a hip problem, or their knee's not working, or whatever. And I watch people run too, and some people run with a weird swing to their, like they'll swing a leg every time they have a stride. Or I pay attention to how the heel strikes. A lot of people run on their toes, or they run on their heels real hard, and they just don't have a good gait pattern. And so things like that, I mean, structural, neurological things definitely affect the way your form is going to happen. Because your body will subconsciously do whatever's the most comfortable. And sometimes what's the most comfortable isn't necessarily the right thing for your body. And it's something to pay attention to. Sometimes it's just good to stand and look at yourself in the mirror and see if you have a high shoulder, or if your hip's a little higher, or whatever. And sometimes people are kind of shocked by that when I show them an x-ray of their spine and see how their pelvis is tipped to the left and things like that. They're just kind of surprised by it because we all have this concept that our bodies are working fine. I don't have any pain or whatever. And in all reality, the structure could be better than it is.
All right, and form's one thing. What are some other things that might affect some of these issues that people might have that would require them to get some of their extremities adjusted?
Well, there's a lot of issues that sports people have. Plantar fasciitis is a big deal now, too. That usually responds very well with adjustments, ice, and we have a taping method that we use for that. I'd say discomfort in any particular place, if you're going to be working out on a daily basis, and if you have the mentality that if I work it hard and make it hurt more, it's going to get better, that's not always the case. And many times during the year, I have people come in that say, you decide you're going to get in shape this year, especially being it's January just happened, and it's first of the year. Many times people will go into their workout routines way too fast, way too often, and in the midst of trying to get in shape, they come in with a sore low back, or they got a kink in their neck or something, because they're not going into it mild to moderate. They're going into it wild and crazy because they want to get in shape quickly, So it's just wise to pay more attention to what your body's telling you. I mean, our bodies give us pain signals on purpose. That means something's not working right or something's not as good as it could be. So just pay attention to what your body's saying and listen to it, and not think that it might hurt today and I'll get up tomorrow and it'll be gone, because that's probably not the case.